Good afternoon, Henry Lewis. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you could do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay.
Hello there. My name is Henry Lewis, and I'm one of the senior nurses here. I can see you're feeling very frightened and uncomfortable right now, and that's completely understandable. I want you to know that you are in a safe place now, and we're all here to help you. This is a common situation for us to manage, and you have our full medical assistance. Before we begin, may I know your name, please?
My name is Mihiraa.
Mihiraa, what is the most pressing question or concern on your mind right now?
I just can't catch my breath, and the pain in my chest is so sharp. Am I having a heart attack? What's happening to me?
I hear how scary that must feel, and it's our priority to find out exactly what is causing this. To do that effectively and to start making you feel better, we need to begin some initial treatment and run a few important investigations. This will include checking your vital signs and may involve taking some blood. May I have your permission to proceed with this initial care plan?
Yes, please. Whatever you need to do. Just help me.
Thank you, Mihiraa. That helps us a great deal. The first thing we need to do is our standard procedure for someone with chest pain and dizziness. This involves connecting you to some monitors so we can keep a very close, continuous watch on your body. By doing this, we can figure out the most appropriate treatment for you and work towards making you feel better as quickly as possible. Now, let me explain what we'll be monitoring and why each one is important for you right now. First, we'll track your blood pressure and your heart rate because they give us vital clues about what's causing your dizziness and pain. We'll also place a small sensor on your finger to check your oxygen levels. This is completely painless and just ensures your blood is getting enough oxygen, which is crucial when we're concerned about chest pain. We'll check your temperature as well, as a fever can sometimes cause symptoms like the ones you're experiencing. And finally, a very key test for your chest pain is an ECG. This is a simple and completely painless test where we place some soft pads on your chest and limbs. It doesn't send any electricity into you. It simply listens to the electrical rhythm of your heart and prints it out on a graph for us. This helps us see immediately if there's any strain or irregularity with your heart's function. All of this together gives us a full picture so we can help you effectively.
Okay, that makes sense. I'm just so worried.
It's perfectly normal to be worried. To help us get a full picture and provide you with the best care, I need to ask you a few questions about your general health. Can you tell me about your medical history? For instance, have you ever been diagnosed with or experienced feelings of anxiety? Are you currently taking any medications, either prescribed or from the pharmacy? And do you have any relevant habits, such as smoking?
I do have anxiety, actually. I've been on medication for it in the past, but not currently. I don't take any other medicines regularly. And I don't smoke. I've never had pain like this with my anxiety before, though.
Thank you for sharing that, Mihiraa. It's very helpful information and gives us a much clearer picture. So here is what will happen over the next little while, step by step. First, I'm going to connect you to our monitors right now, just as we discussed. I'll place those soft pads on your chest for the heart monitor and the blood pressure cuff on your arm, and we'll get the sensor on your finger to track your oxygen. While we're doing that and monitoring your readings, I will have a colleague prepare to take a small blood sample from a vein in your arm. This is one of our most necessary investigations, as it tells us about your heart, your blood cells, and other important markers that can help explain your symptoms. And finally, once we have this initial information, the doctor on duty will come to review you personally. They will look at all the results, talk with you, and decide on the best path forward. I know this sounds like a lot all at once. Knowing this plan, how are you feeling about it? Is there any part of this process that you're particularly worried about, or anything you would like me to explain again?
How long will all of this take? Will I have to stay in the hospital?
Those are very important questions, and it's completely understandable to want to know what comes next. Let me walk you through what you can expect. Mihiraa, after we get you connected to the monitors and your blood sample is sent to the laboratory, there will be a short waiting period while the results are processed. This typically takes about an hour or so. Once all the information is ready, that's the blood results, the ECG tracing, and my observations, the doctor will conduct a full review. Based on that review, we will have a much clearer picture. The doctor will then decide on the best path forward, which generally leads to one of two outcomes. If we need to watch your symptoms over a longer period, we may arrange for you to be admitted to a ward for further observation. However, if all the results are reassuring, the outcome could be that you are able to go home with some advice for managing your symptoms. Mihiraa, I know that waiting can be the hardest part, and feeling anxious is normal. My main advice is to focus on taking slow, deep breaths, which can really help your body relax. Please try to feel confident that you are in safe hands. We are with you every step of this journey, and I will be checking on you regularly to update you and make sure you're comfortable. So, with that plan in mind, how are you feeling about everything?
No, I think I understand. Thank you for explaining everything so clearly. I'll try to relax.
You are doing brilliantly, Mihiraa. Just focusing on your breathing is the perfect thing to do. I'm going to get the equipment now, and we'll get you connected to the monitors. I'll be right here with you, and I'll let you know as soon as we have any updates. You're in good hands.